Endometriosis is one of the chronic conditions that affect approximately 190 million women and girls globally. This condition occurs when tissue similar to the lining of the uterus grows outside it, often on the ovaries, fallopian tubes, or other pelvic organs. Unlike the uterine lining, which sheds during menstruation, this rogue tissue has nowhere to go. It bleeds, inflames, and scars, causing debilitating pain, infertility, and a host of other symptoms. However, the cause of the disease has not been understood. This is according to Dr. John Jagi, an endometriosis specialist based in Kerugoya, Kirinyaga County. According to the World Health Organization, approximately 10% of the women and girls are affected worldwide, yet the condition remains underdiagnosed with average diagnostic delays of 7 to 10 years. This means that in every 10 women, one is likely suffering from the condition.
And basically, statistic will include the following. Out of 100 women who has come to, let's say, Kenyatta National Hospital, how many of these patients have endometriosis? That's how we get statistics. But we've already discussed some of the challenges in getting and coming up with a diagnosis for endometriosis. So you still have patients who have the condition, but they have not been picked up.
In Africa, the situation is even worse. Dr. Njagi highlights that the continent lacks statistics due to low attention and resources devoted to the condition, making it difficult to quantify the number of women affected.
The statistics for endometriosis among African women, it's more than the Western data. We possibly maybe about 20%.
So for now, we depend with the Western statistics.
We have to depend on the Western statistics.
But what are the treatment options for this chronic condition?
In medical treatment, there are different options. There are painkillers, there are hormonal treatment, so on. And there's surgery. So those are the main options of treatment. So when we talk about medical treatment aims to try and suppress the endometriosis. Surgery should be meant to remove
the growth. The endo.
So excising it. Adenomyosis kwanza hiyo
Itulie kwanza. Yes, go on.
So, but however, we still know that the surgical treatment is a gold standard.
Endometriosis symptoms vary widely, including pelvic pain, heavy periods, and fatigue. Some women have severe diseases with minimal symptoms, while others suffer intensively with mild cases. This variability often leads to dismissal by healthcare providers and even patients themselves.
And I'm just going to mention them, So one is saying pain during menses, pelvic pain, infertility. They could have intestinal symptoms, bloating, pain while passing stool, if there's disease that is infiltrating the bowel. Pain during sexual intercourse. As a matter of fact, we find most patients will have pain during sexual intercourse because we have disease that is below the uterus, just about the level of the birth canal or the vagina. So with deep, and the pain during sexual intercourse is very specific. It's going to be pain on deep penetration. Other patients are going to present with fatigue. I'm always feeling tired. What about mental health? Mental health is big.
Even as endometriosis remains a significant health challenge affecting millions of women globally, Dr. Njagi states that having endometriosis is not the end of life.
Structure to these women. If you have, and I'm always...
There should be a support system.
Yes. I'm always blown away by those men who bring their women to the clinic. By that alone, you've already sorted this woman's problem to about 50%.
Because of the mental.
Exactly. Yeah. We need to be there.
Reporting for the Kenya Times, my name is Nixon Jau.